Hi, everyone. Happy 2022. Welcome to our Cool Sculpting live show. We're going to talk about ways that you can non-surgically design and sculpt your body. We know that it's top of mind for everybody this time of year. You're thinking about what can you do in the gym? What can you do with your nutrition? Cool Sculpting is an excellent non-surgical way to permanently destroy fat. We're going to talk to Master Cool Sculpting Aesthetician Sonya, our registered nurse, will be getting online very soon. We're just going to give a chance for a few more people to join. So just hang in there and we'll start fairly soon.
Hello. So I get to entertain you guys for a little while. Can you at least hear me okay? Feedback? Yes, perfect. Okay, well, we're just waiting for Angie to kind of sort out her mic. Funny enough, when we did the test run, it was working fine. So I don't imagine it would take too long for this to fix.
Just go down. Let me do one more audio test. Okay, everyone, if this test does not work, I'm running downstairs to Sonya. So how does it sound now? It's good now. Oh, it's good. Oh, fantastic. Thank you for that small hiccup. Thank you for your patience, everyone. So yes, we are talking about cool sculpting. Thank you. Woo! It's a great way to, in addition to the work that you're already doing with your nutrition and your fitness and your training, it's a great way to put the final touches on your sort of body design. And we all have goals like that. I personally am an athletic person. And even when I'm at my athletic weight and what would be considered an athletic body weight, I still store fat in places that I don't love, like under my arms and my inner thighs. It's just my area. And Sonia has cool sculpted both of those areas for me. And it just takes off it just very subtly reduces that little area of fat that I can't budge through nutrition and fitness. So let's just take a quick look at the agenda for today. And then I'm going to introduce Sonia. So what we're going to talk about the technology of cool sculpting. Are you a candidate? Some of the techniques and the treatment process, our 360-degree approach to our treatments here at the clinic. We're going to look at some fantastic before and after photos. So make sure you hang in for that because they're really great to see. We'll take some questions from the audience. We always love your questions. Thank you for having them. And we're going to give away our gift cards and grand prize. Now, I just want to quickly remind everyone what the gift cards and grand prize are. Thank you, Liz, who put a big smiley face. Everybody that attended the live show today will receive a $50 gift card to the clinic. And as a grand prize, we're going to be giving away a free CoolSculpting cycle. So just wait till the end. We'll be sharing the link, which is what you will go to claim your $50 gift card and enter the grand prize giveaway. So now I'd like to introduce Sonya. Many of you know her and love her. Sonya is a registered nurse, and she's really a specialist in medical aesthetics and master trained in CoolSculpting. Sonya, hi, how you doing?
Hi.
I'm just curious. This is not, I'm just throwing this question at you live, but I'm just wondering if you have any resolutions for the year. Or are you the kind of person that says, I'm not doing that?
Funny enough, I was told I'm not supposed to start my resolutions until the Chinese New Year, which is, I think, mid-February. So I'm supposed to be planning my resolutions now. So I'm in the brainstorm phase. And I don't like to per se give myself restrictions with resolutions, but more like goals. Like I want to paint more this year. I would like to try to do like the gym, hopefully at least some sort of home workout or workout at least like 3 times a week. And then drink more water, like those kind of resolutions.
Fantastic. And yep, I like the process too. I like the planning for the goals. I think that's a really, really great way to do it and will achieve results. So thank you for joining us, Sonya. So we're going to talk about the technology in just a quick second, but what we wanted to show are a couple before and after photos that show the typical areas that can be treated. I mean, lots of the body can be treated, but very typical is lower arms, and you can see the difference between the uppers and lowers there. Another area that is commonly treated is the chin. Sometimes people refer to this as a double chin, and it's an area that just does not budge even with weight loss. And then also very common is the abdomen, just a problematic area for many, many of us, especially as we get a bit older and some of our hormones change, and we tend to store fat in the abdomen even if we didn't before. So let's talk a little bit more. Let's hear from Sonya, who I mentioned is master trained. She has had advanced specialized training with CoolSculpting, has treated many, many patients and had amazing results at the clinic here. So hi, Sonya. Let's just dive right in. Tell us, first of all, to begin with, what is the technology and how does it work?
So CoolSculpting works through something called cryolipolysis. And I'm actually going to go into a little bit behind like how it even got started is 2 things. Children who sucked on like free popsicles as like during like hospital stays, they noticed they would lose fat in their cheeks. And females who rode horses from like the cold saddles on their inner thighs, they actually would notice like fat reduction on their inner thighs. So this technology kind of came around even in the 1950s, them realizing that fat responds really well to the cold. So CoolSculpting itself has been around for about 20 years, and it works through exactly that, the state of cryolipolysis. I love this video because it basically is showing the fat being sucked into the device. It freezes the fat to -11, causes the fat cells to go into a state of shock. And then over the next 2 weeks is your body goes in and cleans up the dead fat cells with macrophages, white blood cells. And then over the next 2 months, you basically get rid of it through your lymphatic system.
That is very, very interesting, and love that we have this type of technology available to us, thankfully. It is a great alternative to surgery for those who aren't interested in having surgery. How long do the results typically last for?
So the cool thing is you're born with a certain number of fat cells. So as we gain and lose weight, those fat cells either just expand or shrink. And CoolSculpting does permanently kill that fat cell. So when that fat cell is targeted and froze and it dies, unless you become morbidly obese, like 400 pounds, that fat cell is not going to come back. And I've even seen some people who we CoolSculpt, say, a certain area of the abdomen, say they gain, unfortunately, 20 pounds, you can still see where CoolSculpting happens. So how long do the results last? They are permanent.
Okay, great. And is it, what would somebody expect from the treatment in terms of discomfort? Is it uncomfortable? What happens?
So I kind of describe it as like the first 10 minutes, the area will feel cold. It will feel like somebody kind of put ice on your skin. It takes about 10 minutes and then the skin kind of goes numb. You're probably watching TV or playing on your phone, and some people even sleep through it. And then I take off the applicator. I do a massage. And this part can be a little bit painful. I kind of describe it. A lot of people say it feels like when you go in the cold and your hands get frozen and you come back inside and you put it under like warm water, it almost like burns a little. That's kind of the sensation you feel when, so is it painful? Most people, I would say no, but some people do say it is painful. If it is super painful or you're sensitive to pain, we also have laughing gas, which you can use for pain control.
Right. And you just saw the quick video there of Sonia doing that massage. And yeah, that's how I would describe it, is it is kind of like a burning sensation when the massage is happening, and it was tolerable. Let's talk about the difference between CoolSculpting and liposuction.
The difference, huge difference. One's non-surgical. So CoolSculpting, you don't break the skin. Basically, as soon as you leave the clinic, you can work out. There's no limitations. You will be a little bit swollen for about 2 weeks and a little tender to touch for about 2 weeks, but that's about it. So downtime's huge. CoolSculpting, you may need more than one treatment though. So that's possibly a negative. As with liposuction, it's a surgery. You do have to go under. They are incisions. The recovery time, I feel like, can certainly be longer. There are large risks also involved sometimes with surgeries. But the nice thing is it's probably a one and done.
Yeah, that's right. So surgery, kind of you're in and you're out in a day. You have a 1 to 2 week recovery and you're done. Whereas CoolSculpting would be like, how long could a typical, treatment plan of CoolSculpting be for someone?
Like as far as hours in the clinic?
Or yeah, like, or hours or weeks, or how long could the treatment plan take?
So I feel like, so say we're talking about abdomen and flanks, it'd probably be about a 3-hour day to get that whole area in. And then 2 months later, typically we have you come back and do a similar treatment round. The cycles may change slightly because obviously your body is changing. The pockets are most likely smaller, so we may have to change the applicators we use, but I'd say usually typically 2 rounds and you can see the results 2 months later. So it is usually like a 4-month kind of planning thing.
Right. Okay. That makes sense. Great. So that was really good to hear. Now we do have at the clinic here is sort of an integrated approach because we combine cosmetic surgery with medical aesthetics. I think one of the times that patients often choose surgery is if they're already having a surgery. So if somebody's already having a facelift and they've got an area of fat in their neck, then that might be a good time to do liposuction. But there is a lot to be said for avoiding that altogether if you don't need to. Okay. Let's talk about more about like who is a candidate. So when you're selecting patients, because of course you have to choose the right patients for the treatment, who are you selecting? Who's a candidate for CoolSculpting?
So the absolute ideal candidate is somebody who's kind of already in the trying to be active at least. And they have a pocket and they're like, no matter how much weight I try to lose, this pocket's always there. Or genetically, say they're just like, my family, we always have the double chin. And I know if I don't have it now, it's coming. So I feel like it's like a localized pocket that just won't go away. So inner thighs, lower abs, under the chin, and arms are probably the more common areas.
Okay. And do people actually see a reduction in weight on the scale?
No, unfortunately. So how much fat weighs is actually quite light. They almost compare it to marshmallows a little bit, being like, if I take away a whole bag of marshmallows around your flanks, it's not really going to show up on the scale, unfortunately.
Right. Okay. Right. So good to know when we consult patients. And if you do decide to come in for a consultation with Sonia, you'll learn all about this, and she'll pinch and probe and look and decide if it's the right type of fat in the right areas. Let's talk a bit more about the process then. So we said, can you talk about a typical consultation, just kind of expand on what I just said about a consultation?
Yeah, so I feel like when I have somebody come in, I'll usually ask them how much they know about CoolSculpting. I feel like you guys are already learning a lot about this already, so that's the first step. Then I usually ask what areas they're concerned and how long has it been their concern, what they already done to treat it. I then kind of will have to mimic what the CoolSculpting machine does. So I will usually pinch and mobilize and see how the fat moves. Then I'll probably have a better idea for what applicator type you need. So there are 5 different applicators I can use on the fat pocket. And then, yeah, I feel like then we talk about pricing, and then we talk about what the treatment day actually looks like, which is depending on the time. So a time frame and what you'll kind of be doing, which is just usually relaxing and watching TV, and then the treatment's done.
Great. And one more thing is just the term dual sculpting. And what does that mean?
So we're lucky enough to have 2 CoolSculpting machines. So that means I can treat 2 areas that are opposing at the same time. So inner thighs and arms, we can have 2 machines hooked up to at once, which kind of makes it like a lot quicker. Instead of doing one cycle, waiting 35 minutes, another cycle, you're able to do both at the same time. So it's, I guess, time management and a lot easier for patients.
Well, it is nice because I guess it can theoretically reduce the treatment time in half. So that sounds kind of nice.
Yeah.
Great.
Yeah.
I know everybody is very eager to see some before and after photos. So why don't we jump into that? Are we ready for that, team? Because I might have jumped ahead a little bit. There we go. Thank you. Sonia, what have we got going on here?
So this was stomach and abdomen that we treated. So her concern was actually feeling like her upper abs held on a lot of volume. So we did a treatment to the upper abs. And funny enough, this was actually just 1 round. She definitely like hyper responded. It looks really good. I do see the question about on the side. Do you want me to answer that now?
It's up to you. If you can let me know if you would like to now or later or whatever you like. Later, maybe.
Okay.
When we
I feel like I might as well talk about it. So
Yeah,
there
sure.
is a question about a complication that occurred with Linda in the news. So she had something called PAH, which is paradoxical hyperplasia, and it's happens 1 in 10,000. It is there an age factor? No, there isn't. There's not a sex factor. There's not a placement. It's just when a fat cell, so 1 in 10,000, instead of deciding to go into a state of cell destruction where it dies, it actually decides to multiply. You'll see this. It'll basically occur 5 months after the procedure. So it's not something you'll get swelling right away, and that's not this. It's about 5 months later, and it'll literally look like the shape of the applicator. Then when this happens, we open a case as an adverse event and submit that to Allergan with photos. They then review the photos with 2 doctors, and then Allergan is then responsible for, if it gets diagnosed as being PAH, then they will surgically have that area removed because it is a complication that their machine did.
Yeah, right. So yeah, it's good to talk about it, and it's good to know it is extremely rare, and it's an important part of the the process when you have a consultation and understanding the risks. And there are risks with many of the procedures that are offered, but it's just important to understand them and be briefed on them appropriately. So we were looking at CoolSculpting before and after photos. Let's get back to the other one. So I think we just saw abdomen. Great. Oh, this is another excellent example of an abdomen. Okay, let's hear more about this one, Sonia.
So this is so exciting. So she actually came back last week, and I took this after photo, and she was like, it's been over Christmas. She felt like she gained weight. And I was like, hold on, I need to show you your photos because I think you look amazing. I'm like, do you want to get treated today? And she's like, yeah, I don't know. She's very excited with her results, obviously. So she did flanks, upper and lower. So that's kind of under the bra area. And then the top, I guess almost like a muffin top area. And it just looks so much smoother now. She's really happy. And same with abs. She has been doing intermittent fasting is what's worked for her. So she has been trying to do that as well. Is CoolSculpting suitable for postpartum body? I would want you to not be breastfeeding if that's okay. So your hormones do fluctuate when you breastfeed, and that can impact your ability to kind of metabolize fats. So usually we want to wait anywhere from 6 months to a year postpartum and not breastfeeding. Anyways, good.
Great.
This is one of our lovely staff. He did under the chin. So we did 2 rounds of CoolSculpting here, and I feel like we didn't get a chance to do Belkyra, but I typically like to pair the 2. So CoolSculpting, if I can do it, does a great job of kind of debulking the area, which I think it did really well for this one. And then if you felt like you wanted just a little bit more to kind of clean it up, we have the option then So the pocket is now too small in the after photo to fit into the CoolSculpting applicator anymore. We can actually now define it a little more with Belkyra.
Great. Okay. And for someone that doesn't know what Belkyra is, can you talk a little bit about that?
So Belkyra is a fat dissolving injection. It's done micro droplets under the chin. And what makes it so cool is that it's very customizable. So I can basically map out where I want to treat. And I just do these micro droplets under the skin, or sorry, in the fat pocket. Similar downtime with CoolSculpting in the fact that risk of bruising with both. You both have swelling. It's just a lot more customizable.
Great. Yeah. So I think that's one of the, so one of the benefits of having different modalities to choose from is being able to choose what's going to be right for each patient and also combine to get the best result. And yeah, so we're looking at another lower arms treatment. Yeah. So you can see how it just looks like the arm isn't hanging so much underneath anymore.
So I do have to say, this is my arm. I know. I absolutely loved it on my arms. Like that one too. I felt like when I put my arm down, like my arm wasn't bad before, but I was so happy. Yeah.
Oh, great. Now Bella wanted to just she wanted to clarify her question.
Yeah.
So she's asking if in my previous question, age factor, I was asking if CoolSculpt, if your age matters when you're having CoolSculpting. Does it matter at all?
No, I feel like it's less. So I've had my own mom do it. She had great results. Very happy she did it. I think when I talk about hormones with postpartum pregnancy, I will say to some degree, I notice a little bit with like age and females specifically. I feel like as we age as females, maybe you're noticing like you're gaining weight in certain areas that you normally wouldn't. And you can see good results. It sometimes will just take more treatments, to be 100% honest. It's still achievable. I don't know. From my experience, it's just a little slower.
Okay.
Yeah.
Great. No, I think we've covered the before and after photos. There is one thing that I skipped over, and that was to ask, do you have any tips and tricks for staying on track with your weight loss and fitness goals during COVID? Is there anything that you've been doing? Oh, I can talk forever about this. You go first.
Okay, what have I done? I feel like, well, it's also been COVID for like 2 years. So what have I done in 2 years? I feel like tried at home apps to do. I do like these inspired go salads every day at work. So trying to like meal plan. I also have been doing like painting and meditating. So working on like, stress, and they always say like how much you gain from literally just stress. So I've been trying to keep mental health as part of a priority, drinking lots of water. I have like a giant 2-liter thing of water beside my desk, and it's at least a goal. Even if I don't hit it, it's a like gentle reminder to drink more. I also really like doing infrareds. Yeah, lots of things.
Great. Okay, good. Yeah, no, that's good. I think, we're all doing the best we can and trying what we can. I personally try to do a detox or a cleanse a few times a year, maybe 3 to 4 times a year. So, that's basically where I just really clean up my diet for 1 year. 1 year. No, sorry. 1 week is what I meant to say. And, I don't necessarily calorie restrict because that's not healthy for me, because I'm always training for something. But yeah, it just sort of gets me off my sugar addiction, and I think I start to de-bloat, and that's always a nice thing to try. And really, did we discover if gyms are opening again, Sonia? Has that been announced today?
I think it's at 1:30 today.
Oh, we're waiting for the announcement, and
yeah. I'm sure everyone on this chat is the same thing.
Yeah, fingers crossed for our friends who are our other small business owners in the area that the gyms will reopen for you, and you can have your clients come back and we can all come back. We have another question from Michelle. Can you CoolSculpt over areas that have previously been lipoed?
Very common, actually. So I didn't discuss this with liposuction, but typically how it works is you fill up an area with fluid, and then you go in and you kind of with a rod to liposuction the fat away. But I feel like when the fluid and everything goes and the fat, what's kind of left as fat settles, it can sometimes like accumulate or feel like there's a little lump left behind. Honestly, it works so well with CoolSculpting because we have like a little applicator we can just put on. We just treat it as a new little pocket of fat. So I have I know clients clinics in the US, they strictly just do post lipo CoolSculpting. So there's a big enough demand for it just to kind of even out little bumps. Or I know the top of the ribs just underneath the bra, they can't actually usually get with lipo abdomen. So people will then get that area just CoolSculpted because they weren't able to get it lipoed. So I hope that answers that one. And then how many cycles did I do to my arms? I actually did 2 cycles per arm, and I was able to get that with 1 round. So that was pretty cool. So 4 cycles in total.
Yeah, that's great. And I think I did my arms with 2 cycles, which was enough for me to really see a noticeable improvement. Okay, some other great questions coming in here. Thank you to Emily. Do you recommend to carry on intense workouts on the same area you've CoolSculpted? Like in between cycles, can you continue with your intense workouts? And
I actually think that's a great question or comment. I think it actually amplifies your results because you are already like trying to burn fat. And so your cells are now in a state of shock, and you exercising is actually like encouraging lymphatic flow. It's encouraging circulation. And then you're also kind of telling your body to metabolize fats. So CoolSculpting does pair really well with working out. And it's also like a kind of, I don't want to say a subliminal, but it's like, oh my God, things are fitting so well. It keeps you, it is half CoolSculpting, but like it keeps you working out because you're just really happy with how your body is transforming.
right, excellent. There really is no downtime. I went back to my usual workout, the next day. I probably would have done it the same day if I could. It just didn't work out from a timing perspective.
Yeah.
So let's now talk about, I know that people are probably going to get on with their work day now. So we're going to do the giveaway, and then we'll go back and we'll keep answering, not do the giveaway, but I will give you the info about the giveaway. And then we'll take a few more questions. And then Sonia also probably has to get going as well. She's a very busy person. So everybody, as we mentioned, everybody who attended today will receive a $50 8 West Clinic gift card. So you can go to 8west.ca/gift claim to get your $50 gift card. There is a password. It's CoolSculpting 888. That will also enter you for the grand prize draw of a complimentary CoolSculpting cycle. So I just wanted to say that there is a time limit. You have to complete this form in the next, was it 6 hours or 8 hours? Barbara will tell me. Please complete this within the next 6 hours, I believe it is. We had to put a limit on it for some reason. And if you have any questions, we'll be able to help you with that. Just put your questions in the chat here. So another question that we had, which is from Ganzaya, how long is the meeting? Oh, I just answered your question. We're going to wrap it up now. And then the other one is is it true that treating the inner thighs is difficult because of the applicator?
So inner thighs, no. Inner thighs are quite easy to treat as far as the applicator goes. It's outer thighs. You actually need like quite a saddlebag on the outer part of so that's an inner thigh example. Outer thighs, you need kind of like a peak on, that area just by the bum and leg out to the side. If it's flat and just a small little bump, then you run the risk of indenting if the bumps, like the area to be treated isn't big enough. So it does have to be a certain pocket for the outer thighs. Inner thighs is quite easy.
Okay, great. Well, these have been amazing questions. Thank you so much, everyone. Can my team help me here? Is there anything that we missed or that I should cover? Should we wrap up here to let everybody get back to work? How are we doing? Sonia, really fantastic information. Thank you so much. We've seen such great results from you at the clinic here. So well done. Everyone, thank you so much for joining. And yes, the code Amy is CoolSculpting 888. Now that information is on the screen right now, and I believe will we be sending that out, or is it just being given verbally right now? Can just continue with your questions here. If you have any, you can also reach out to our team. You can email us through the emails that were sent to you. Thanks so much, everybody. I think we'll let you go. We're just giving it now. Giving it on the screen. Yeah, perfect. Okay, everyone. So 8west.ca/gift claim. Use the password CoolSculpting 888. Thank you so much, everyone.
Thanks
Happy
for joining.
all the best with your goals and objectives for the year.